We're wrapping up part one of our series on Canada's healthcare system with a look at something that often confuses patients and frustrates providers: the power struggle between provincial and federal governments. But before we get to that, let's talk about MAID. You've covered medical assistance in dying, and how is this conversation being shaped by a lack of access to care?
That's a good question. My suspicion is that yes, there are cases where people are not receiving the care they need. They're struggling with pain. I mean, we've seen news stories reported on this where patients, struggling constantly, dealing with crippling pain, whatever the case is. And so then they're looking at MAID as a solution because the health service they require is not being provided. And I
Yeah.
mean, that's just a tragic case. I don't think that was part of what was initially conceived with MAID. It was supposed to be cases where there was no option for them. They're dealing with constant pain. Uh, their death was near certain in the near future. I think that was sort of the initial thinking behind MAID. And it seems like there's a heck of a lot of cases where people are getting MAID in this country,
Mhm.
and it's not fitting that initial criteria.
Right. So let's go on and talk about the provinces and government. Can you explain how healthcare responsibilities are being split between the provinces and the federal government? Who is responsible for what, and how are they intended to work together?
Yeah, that's a very good question. So to simplify it, I mean, healthcare is largely a provincial responsibility.
Okay.
Provincial governments run health regions, they fund them, they fund hospitals, they determine sort of the micro policies, if you will. Where Ottawa comes in is they will provide provincial governments with about a fifth of the funding. So around 20% of the money that's spent on healthcare comes from Ottawa. And Ottawa says, well, if we're going to give you that money, you've got to meet the terms in the Canada Health Act.
Mm.
And so those are things like making sure that there's universal coverage for patients. They don't allow user fees, those types of things. So that's where Ottawa comes in, but healthcare is largely a provincial responsibility in this country.
So where do you think things tend to break down in this arrangement then?
Well, it's sort of like the old expression, you've got too many cooks in the kitchen. Um, I think you need one level of government handling healthcare and
Mm.
get the other one out of the equation. So the best possible scenario, in my opinion, Julie, would be you would have Ottawa just not fund healthcare anymore, reduce their taxes, allow the provinces to raise their taxes by the same amount,
Mm.
so it's the same amount being spent, but then you have the provinces raising all the money that they spend on healthcare, and they're the ones that spend it, so they're completely responsible, and you can't have the finger pointing anymore because this happens sometimes, right? You have
Right.
the finger pointing between, oh, Ottawa's not doing this and provinces aren't doing that. Just
Mhm.
separate the two, say, okay, one of you do healthcare and the other one you keep your nose out of it.
Okay.
One of the problems we have in this country with healthcare is that Ottawa, at least under the current government and maybe to some degree under the previous one, becomes politicized, and they say
Yeah.
to the provinces, if you don't do what we want, we're going to cut your
Mhm.
funding. We've actually seen that where Ottawa's played a role where they're actually harming healthcare because they're
Yeah.
cutting funding to provinces that have made some good decisions that actually help patients, but Ottawa has kind of used it as a political tool to try to curry votes and, bow down to special interest groups or whatever the case is. So I think you got to separate the two,
Yeah.
just to have the provinces run healthcare.
I've also heard of Canadians traveling to other provinces for better diagnostic processes or treatment options that aren't available to them at home. What are some examples of the differences between the provinces?
Yeah, so what happens is basically everyone's covered in their own province. There's often rules that say you can't pay for surgery in your own
Mm.
province. Quebec is an exception to this, but in most cases, you cannot pay for services for surgery in your own province. So people will then travel to another province. We actually have this crazy situation where you will find, for example, Calgarians flying to Vancouver for a procedure while Vancouverites fly to Calgary for the same procedure because they're not allowed to pay locally.
Oh my
So it
goodness.
doesn't
That
it
doesn't make
doesn't
any
make any
sense.
sense at all.
Oh, wow. Well,
Makes
we've
no
run
sense.
out we're running out of time, but thank you so much. This has been incredibly informative. I really appreciate you taking the time.
Thanks for having me.
Thank you for joining us today. We'll be back next week with part 2 of this series, where we'll continue this important conversation and explore some of the solutions that have been suggested, including the controversial idea of private care or co-payments, as well as using new technology like AI diagnostics to help rebuild a system under pressure. Thanks for joining us. We'll see you next week.